World Heart Day, and today we are here to celebrate it in a very different form. We are going to have a live interaction with Dr. ARJUN. He is very well-known doctor in Kolhapur and Kolhapur district, and I'm really very thankful for him that he has given me time to have a conversation with him and spread this message that these days are just not meant to be in the calendar, but for people to know that why these days are celebrated. So I would like to know your introduction from yourself.
Good morning. I am Dr. ARJUN. I am an interventional cardiologist practicing in Kolhapur at SWASTIK hospital. You are most welcome to today's World Heart Day. Today's day is very special because we get reminders. Yes, we have to move ahead with our health, progressing for a better health and making use of the available technology today.
That is what a theme is given by the World Heart Federation, that you should harness the power of digital health and spread awareness and bridge the gap which we have got in this pandemic period, that there is so much of big gap between patients and doctors, relatives, friends. So all these gaps also can be bridged by this theme as well. So my very first question is that what was the difference between pre-pandemic cardiac care and the post-pandemic cardiac care?
Pre-pandemic cardiac health was a routine thing. The patients used to have a routine presentation, the age group was defined, and the subset of patients that were at risk factor to heart disease were defined. But after the COVID came, any patient, any person can have a fatal cardiac event, right from in utero before birth to elderly age group. So we are seeing children of 2 years, 3 years, 23 years, males, patients, young patients, 30 years, 35 years, getting heart diseases in the form of dilation of the heart, congestive cardiac failures, and heart attacks. So the group is increasing. And when this group, it was like a Titanic. They thought that we are indestructible. Our age group is not that we should get a cardiac disease. But when they sailed in the sea of COVID hit them, and definitely all these Titanics began sinking. So we have to remember, we are not Titanics. We don't have to go the same way as that of the Titanic. We have to take our own heart and health in our hands.
Yes, after all, we are human beings, not the Titanic ship. So the next question is, how did your patients come in contact with you? Or they had their follow-ups during the pandemic and the lockdown? There was completely lockdown.
Initially, it was a disturbing phenomenon. Initially, we also could not understand how the patients are sitting at home and how they are unable to come to the hospitals. We got some few broadcasts to the hospitals, which we knew patients. They had depleted their medicine sources. They could not go outside to take their medicines, and they skipped the medicines for about 5 to 6 days. This is when they had fatal events, and they were brought to the hospitals by ambulances, and they were brought in a broad death condition. So we could not do anything. We could not absolutely do anything. Immediately we realized we have to step in and bring other resources so that the people sitting at home can avail the benefit of the hospital or the doctor consultation. So we started the video online so that the patients can immediately take help of the doctors and immediately consult them whether to arrive at the hospital or not to arrive at the hospital. And whenever they arrive at the hospital, we give them suitable timings so that they should not come in contact with any other COVID relative of the patients.
This is really good to hear that you took such good initiative, and which most of the doctors think that online we cannot do it. But it was really great initiative taken by you. That's really appreciable. So which is more easier for patients to come online or just to come directly to the clinic?
Both ways. Both ways are the beneficial to the patients. Online is beneficial because if they cannot go to the hospital on their own, if they have any disability, going outside, if there is nobody at home, so they can avail these benefits. In an emergency situation, they are starting to get a chest pain. They can immediately call a doctor. Doctor, do you think that I should come to the hospital? That is the main question. Do you think that I should come to the hospital? And yes, getting a consultation from directly the main doctor is very important. There is no interface in between. There is no intermediate doctor in between. So that advice to the patient is important, life-saving, and according to the advice, they can come to the hospital immediately, get their checkups, ECG, blood pressure done, and then accordingly get the treatment. Or else we can advise them suitable timings to come to the hospital and not to panic because their conditions were not a cardiac.
Very nice. It's really very nice to know that these are the ideas you brought up during this pandemic, and this can be like for long we can use it. There's no need to be pandemic or normal life. So this question I personally had it because few days back one of my friends' husband had this problem. So from that time I had always this curiosity or a question trailing in my mind that most of the time we have a habit that we have some pain in body or even in tooth pain. We directly don't go to doctors, we go to medical first and we tell them, भैया एक दर्द की दवाई दे दो, दादा इथे पाय दुखतंय, कंबर दुखतंय, and we take those medicines without any concern. Now we don't know any history of our pain. And what happens is like you get some feeling of having heaviness in chest. There is something like you feel there is acidity problem or dizziness, and all of a sudden you get to know that you have some kind of heart problem with that medicine. Is it something that these painkillers they are affecting our heart in this 2 years? Is something happening like that?
There is a thing that is happening because people do go to the pharmacist for a shortcut. Yes, my pain should be relieved, so they take painkillers. The painkiller does relieve the pain, but it does not relieve the cardiac disease, which is ongoing and which gives a fatal event. So better consult a doctor before taking your painkillers because the painkiller can relieve your pain but not the disease. It's a temporary thing. So please do not go for the over-the-counter drugs. Kindly consult your doctor first and then only take these painkillers. And painkillers after a certain dosage can affect your kidneys. So also consult your doctors for these painkillers.
Yeah, so from these all experiences and hearing, getting newspapers, news, and even some recently we lost an actor who took a medicine at night and we wake up in the morning. So from that, I just said to myself, whatever pain you have, whatsoever it is, first go and consult your doctor.
Okay.
Don't take any of the painkillers or paracetamols. Any of paracetamol in this COVID is not good for your health. So please, it's a request from me as well as doctor that whenever you have pain, just know your history of your pain. Go to doctor. It won't take much effort. The effort which you will have to suffer when you get some cardiac arrest or some kidney problem. So please consult your doctors. Now doctors are available online. There are so many websites where online consultation happens. Even you can call on a phone and have a small talk and just take relief from your pain and whatever problems you have. So this was really a very nice thing we can tell people. So just like medical, now there are many other healing art therapies or dance therapy which is come in form. So I myself as a dance therapist have a question that would you like to or do you mind telling your patients to practice this kind of yoga therapy, dance movement therapy or healing art therapies?
Quite good. Why the disease occurs is because we are occupied in a certain scenario, a certain given atmosphere daily, where our brain and the mind is so stressed out that it has to counteract the body in such a way that the body becomes fierce, produces cholesterol in excess amounts that is deposited. So to just deviate the mind from having a daily stressed out, burnt out phenomenon, you have to have mind relaxation exercises. And these mind relaxation exercises are in the form of dancing, singing, whatever hobby you are involved in. That is the thing that you should go after. These things, dancing, singing, are good examples of diverting your mind into a peaceful therapy.
Yeah, so recently I just read a news that 30 minutes of listening to music or songs, it releases many of your stress and you need to de-stress your heart. It doesn't get automatic de-stress. There's no automatic button or there's no any tablet to de-stress your heart. So these kind of art therapies, dance therapies, yoga therapy, meditation, they are really good alternative and we should really adopt in a day-to-day life. Like, then to keep our heart healthier, again, what are the things we should adopt in our life? Like the food intake and like other things.
And the first and the foremost important is relieving your stress. The food is a secondary condition, the exercise is a secondary, third condition. But the most important is mental relaxation. You must have seen athletes having a sudden cardiac arrest. You must have seen excellent singers having sudden cardiac arrest. That is the only thing that is a stress. So right from 1 to 9, that is stress, stress and stress only. So if that one factor you involve in your life, relieving your stress, definitely no disease can touch you. Second to that, your healthy diet. Third to that is a daily exercise of at least 45 minutes. First and foremost, try with the stress, leave it out. Second, diet. Third, exercise.
Yeah, so these are the very easy points. I don't think so anything is difficult in this. We can do it. It's very easy. So I guess everyone should follow it. So the theme as the World Health Federation and WHO has given us that harnessing the digital power. So what is your message as a doctor, as a cardiologist, to how they can use their digital tools to get this bridge out and understand, get awareness, get prevention, and we can manage it. It's not difficult that we cannot manage the cardiovascular disease globally, and it's a world heart day. So it's a global message. What would you like to say?
When I was studying, there was no mobile phones. Definitely, we did not face any scenario of pandemics, the lockdowns, or the patient accessing the doctor at that time with the phone. That was not available. Definitely, as the time passed on, we were having these things that the patient was asking to give our mobile numbers to them so that they can't call at the night. Initially, we thought it as a thing that we could not accept. Later on, yes, we knew if we want to maintain the health of the patient, it is important to have a dialogue with the patient whenever they get in stress or whenever they get a disease type of condition. So yes, we have adopted with these new technologies, we have adopted the online scenarios where we consult the patients. For that, we have essential mode, we have kept mobiles so that they can call us anytime they want and we can consult them accordingly. So with the changing scenarios, we also have to change. We have also adopted our practices in such a way as to help the society out in their needful times. And definitely COVID, that was a time when the mobiles were very active. They were very helpful for the patients to sort out their troubles and getting admissions to the hospitals. Initial COVID, we saw ambulances just coming out invariably to any hospital. If they did not get a bed to one hospital, they went to the second hospital. Later, the patients also learned, yes, we have the mobiles, we can contact with the hospitals, we can ask them, we can arrange everything. The government also stepped in. They provided a mobile platform for the patients so that they can call at the center and their center can regulate the admissions to the respective hospitals. Definitely, this technology, patients survive better.
Wow, so nice. So these mobiles are not just to use your Instagram, WhatsApp and send forwards, and it has so many apps which help us to know about your health, your steps. There are so many tools, just like I am wearing a Fitbit. It tells me how many steps I had, what is my heart rate at present, how is my breathing. So you can adopt such tools instead of wasting our money or the things in other. Please use it for your health and it's really helpful. And even apps are there where you can get in contact with doctor. There are so many dietitians and nutritionists who tell you that what you can have it. There's no need to have those all very fancy diets, but your day-to-day food you can just have a little bit up and down changes in that. So these are the very big questions from my mind and the discussions I had with my friends and my colleagues. So the very last question, or I would like to say, what is your message for the people about the World Heart Day, its awareness and prevention?
World Heart Day is a reminder to us that yes, we should remain healthy to carry on a fruitful life, because a stressful disease life will not take you much further. So World Heart Day is a reminder of the changes going on in the society for the betterment of the human mankind. These changes we have to accept and adopt according to our geographical situations. And definitely each World Heart Day, they try to justify what points would be beneficial to the society. And these points are brought to the society from various regions.
Yeah. So it was really good interaction. We had all the answers, questions I have got the answers to all my questions. And I hope I spread this message to many of my friends, relatives and the society which I go on and just keep making people happy. And please don't get scared that whenever you have some disease that immediately you have some problem. Scaring, I guess, is more dangerous. Getting panic is more dangerous. So have a stressful life. When you wake up, just wake up with a smile. Have a good conversation with your family. And if you're not in contact with any of your friends or family, just get connected through your mobiles. It is not difficult for you to get connected with the disconnected hearts.
Right.
So thank you so much for this wonderful conversation and helping me to spread this message to the media of making it so easy. Thank you so much. I'll be very grateful to you, and I would really like to tell each of you that we had a very small conversation and we just decided to take this interview or just a conversation, and we made it. I hope this message goes to each and every person, and you please pick up few points from this and adopt in your day-to-day life. Then it will be a something, what do you say, kind of appreciation for me too. And I would really appreciate Mr. Dr. Arjun ADNAIK that he helped me out with this, all the questions and difficulties. Please use your digital tools for healthy life now, not just to have a selfie and the Instagram thing. Thank you so much, and keep heart healthy, and if possible, please keep dancing. Thank you so much.